I'm Jen Ming, I'm a hand surgeon. So I've been doing hand surgery since about 2012. Then I became a specialist in 2018. And I've only just been out in private practice since about April last year. So I think it started when I was young. Then I had a family doctor that we always go and see, the CY Corp in Ang Mo Kio. As far as I know, the clinic is still running. So I thought that what he did was very cool. As an old school GP, he also did surgery. So minor procedures, he would have another room that he would do them in. So I thought it was very cool to be a GP, and that's how I wanted to be a doctor. Our medical education is actually very hospital-based. So after going to med school and going to clinical rotations, then you kind of always think about what you're going to do in a hospital setting. And then we self-select into who wants to use their hands and be a procedurist versus who wants to be a bit more intellectual and do the medical things. So I always knew that I wanted to do something hands-on. So it was very natural to go into surgery. And it was only later on, then after trying a couple of fields, then I settled on hand surgery. So interestingly enough, I actually didn't know about the existence of hand surgery until about 2-3 years after I had graduated. Actually, what I wanted to do was neurosurgery. And then I also had some interest in orthopedics, bones and joints. So I always thought that I would do something like spine surgery or go into like functional neurosurgery. But then during one of the NHG open house, I ran into one of my seniors who also became a hand surgeon and found out about the existence of this thing called hand surgery, where you also do nerve work and you also do bone and joint work. So it became one of those choices, and I settled on hand surgery in the end.